Hello and welcome to yet another episode of Health Check with me, Roxana Gishia. Today we are delving into a critical and impactful topic, HIV and AIDS. Despite the significant advancement in treatment and prevention, HIV and AIDS remains to be a major global health issue affecting millions of lives worldwide. Our discussion will cover a range of topics, including the basics of HIV and AIDS, methods of treatment, testing, treatment options, and the ongoing fight against stigma and discriminations. We are also going to explore the latest advancements in research and the importance of advocacy and education. Joining us today is Regan Onyen, a clinical officer at Valley Hospital, who will help us understand everything to do with HIV and AIDS. Dr. Regan, thank you so much for coming.
Thank you so much.
How are you doing?
I am doing good, and thank you for invitation. Because today we want to talk more about HIV/AIDS, so that at least a multitude can understand method of prevention, how we can acquire HIV/AIDS, and also the recent technology. Because of the global pandemic, we all know that HIV is still the most disease that is causing a lot of that. Yes.
Thank you so much. So let's start with, what's the difference between HIV and AIDS?
Okay, that's a good question. Maybe to put in a simple term, maybe by first definition, HIV is a human immune deficiency virus. It's a virus from lentivirus. It's a family of virus. And this virus encompasses subtypes and also types of viruses. Like we have HIV-1, HIV-2, and this HIV-1, it's some subtypes, including HIV-2. But in sub-Saharan Africa and Africa, I think HIV-1 is the most common, and the most common cause of that, and is the most common cause of AIDS now. So AIDS now, it's an acquired immune deficiency syndrome. It's a collective term that is used to describe all the symptoms that you can acquire after you acquired HIV. Meaning this is an opportunistic infection that you get after you get HIV/AIDS, after your immune system has depleted. Example, maybe you can have pneumonia, we call it durivasic carinae pneumonia. You can have pulmonary TB adenitis, cancers, and all sort of opportunistic infection.
So you can have HIV without AIDS?
Sure, it is true. Because HIV is the one that make entry to your body. And after it has suppressed your defense system, we call it CD4, that's when all other opportunistic infection now will set in. Because it's like, if we manage to take away our army military, we'll have invaders from every corner. So those invaders now we call AIDS. And there are people who we are told are carriers. And I've heard, I don't know if this is a misconception, but I've heard people who are carriers, when you test, it comes out negative. Is it true? The misconception about carriers, we don't buy it, because actually during the test, what normally happens, we can have false positive and false negative. Let's talk about false negative. For example, maybe this is a person that acquired HIV in a period maybe within 3 months, and you go for test. Actually, it will test negative. Why? Because the body defense, it has not manufactured enough HIV antibodies to be detected. When you have HIV/AIDS, let's say when you have HIV virus, the body has to manufacture HIV antibodies. So these antibodies has to be plenty enough to be detected. So at this period, within 3 months, definitely will test negative. But in future, maybe after you tried in the next 6 months, you will test positive. But we have other tests that it can detect it within 10 to 14 days. Like nucleic acid test, like CRP, PCR test, polymerase chain reaction test. Those are recommended tests that it can detect your HIV within 10 to 14 days. But if you go to this standard, definitely test negative. And then maybe poor techniques of testing can obviously test negative. Maybe also storage. You know, there's a certain degree of temperature that you need to store your kit. And then also maybe the sample amount of the blood that you need to use. So those will affect the results. Yes.
We're going to come back to that. But for now, let us just go to the signs and symptoms. What are some of the signs and symptoms of HIV and AIDS?
Okay, putting about signs and symptoms, we describe it on stages because we have World Health Organization staging of the HIV, and we have the normal staging that we know. For example, we have a window stage. During the window stage, purely you don't have any symptoms. Maybe you can have mild headache, maybe cough, running nose. You may not even know that you have HIV AIDS until you go and test. Actually, when you go and test, it is still negative. Then we still have asymptomatic period. This asymptomatic period is just precede the window stage. There's nothing much until when you reach the symptomatic stage now. That's when you want to present with the cough. Maybe it's a chronic cough that is not ending. Persistent headache. You'll be coming to hospital complaining migraine. Sometimes you develop chills, and then later you now start getting diarrhea, vomiting, loss of weight. That's when now people realize that my body is changing. So when you come to hospital now, that's when we'll detect you the HIV. And then from there now you go to full-blown stage. All symptoms have set in. AIDS now has set in. So you have tuberculosis, you have cancer, you have skin diseases, you have cancer like Kaposi sarcoma. So that's the presentation now. And
HIV has a long incubation period. So how long can you go without it being detected?
Mostly, as I said, the recent advancement, we can detect HIV within 10 to 14 days. But HIV is a slow growing virus because it needs to come and bind. It need to come and do fusion. From fusion, maybe we go replication, integration, all those process. So it takes times. Actually, if you get HIV today, maybe in the next, after 72 hours, it will have multiplied, but it does not affect your body because they need to plan to regroup and multiply so that they have a good number of viral load to attack your body. So the incubation period, you can say, is as much as it is longer to be detected, but once it enters the body, the process starts. But in recent advancement, we can detect within 10 to 14 days. But our normal standard test, we call it the rapid test. You need at least 3 months or sometimes 6 months.
So let's talk about testing, because we've talked about testing so many times. So testing, there is the self-care, the self-test kit. How effective is the self-test kit?
In terms of test, we have a rapid response test, including that self-test kit, and we have confirmatory. If today I give you the kit to go home with it for testing, and you realize that you have tested and it is positive, that result is not positive until we confirm. So maybe to make people understand, that kit, it picks any virus that looks like HIV. As my earlier explanation, I said that HIV is from the family of virus, lentivirus. Remember, this lentivirus have other viruses. So, and they mimic the character of HIV. So the antibody will say, there's something like HIV. Yes, it is. And then it will test positive. But when you do confirmatory, that one is specific. It will say either negative or positive. So once you do it at home and it is positive, you come back to hospital, we do confirmatory test. If it is positive, therefore it is positive. But sometimes when you dispute, we can urge we do the PCR test. And also it can be negative, and it is false negative. Why? Maybe techniques, you never put enough sample, storage, something like that. So you need also to confirm. And when you come, we'll do the still rapid test to repeat whatever you did. And then also, if it is negative, you go home. But if it is positive, we have to do confirmatory. If you argue about it, we can order the PCR, or we tell you to repeat after 2 weeks. Yes. I'm listening to you, and I think I'm overthinking on this, but I want to get it clear. Once I come to you and you give me the self kit, I go at home and I test myself. Sometimes it comes out negative, Sure.
But again, you've said that it takes a few days for you to know exactly if you are positive or negative. So maybe the people who take the kits because they want to engage in sexual activities like right now. So I've tested my partner, and it has turned out negative. So is it a lie? Because sometimes maybe I have the HIV and AIDS. It's just that the period that I'm at, the state that I'm at, is not easily detectable. So why do medics encourage us to use the self-test kit if it's not as, okay, it is accurate, but it's not as effective as the ones that you do at the hospital?
Okay, we have the global strategy of HIV controls that insists that at least 90% of the population should know their status.
Yeah.
90% of the population that know their status should be initiated immediately to medication.
Okay.
And those on medication, 90% at least should adhere to medication. We achieve viral suppression. The reason why I encourage self-kit is we have people that they don't want to be tested. Maybe they feel that there's lack of confidentiality in the hospital. They feel that, there's that misconception that I went there in the hospital, my status was shared, which is wrong. So people have that misconception. That's why we give them self-kit, but to do advise them. We normally counsel them before we give the kit that whatever you get might not be the true results.
Okay. Because
we normally teach them how to use it, the correct amount of the sample. But still, you can get false results or false negative or false positive. Okay. Yeah, depending on how you chose to nini. And remember, maybe you use let's say this patient or this client has been on a PrEP, definitely it will test negative. Why? Because already the virus has been disorganized. Okay. So this person, we normally encourage them to come after 17 days. It will test positive. Okay. Yes.
Yeah, we are going to come back to PrEP and PEP because that is a conversation that most people need to know. Yeah. And people are misusing the drugs, the PEP and the PrEP. Yeah. But before that, let us just go on transmission first.
Yes.
How is HIV and AIDS transmitted?
Okay, on transmission, we have modes of transmission. We normally call them a primary mode of transmission. Yeah, we have body fluid that mostly preoccupy the transmission. We have blood, we have semen, we have vaginal fluid. So maybe talk about them. You can say sexual transmission, maybe through sexual contact, you can transmit blood transfusion, injectable drugs, maybe you are sharing needles. Yeah. We have also those who normally, people who inject drugs, they can get transmission if they share the needles. Also, mother to child during breastfeeding, and then also pregnant mother who has HIV but maybe was failed to be tested, therefore viral load was high and maybe it can be transmitted through the baby. And also during birth, when there's poor techniques, the child can get HIV. So those are the most common mode of transmission that affecting the transmission of HIV. Okay.
Yes. So as I was preparing for this episode, there is someone who asked me a question.
Yes.
And I really want you to answer the questions. Okay. When testing for HIV and AIDS, of course, you'll either find a positive one or a negative one. Sure. So let's assume they have tested positive. Can you know how the virus got to the body?
Okay. That's a good question. So that means is we have life cycle of HIV AIDS and it involves 7 stages. So let's say it was sexual contact maybe, and then the virus enter your body. This virus is very funny. It does not attack anything else. It only wants what is called CD4. Okay. CD4 is a glycoprotein of defense system of the body that contain other defense system. Okay. So maybe on entry, we have macrophages. It will take this virus because macrophages doesn't kill them, just engulf them, carry them to the CD4. They believe that it is the CD4 that will kill them. And the virus now know very well that when I'm in CD4, that's where I'll feed, that's where I'll be multiply, that's where all my stuff will take place. So it is taken there and left there. Once left there, it will attach to the membrane of the CD4. Okay. Once they attach, they will fuse. So fusion will take place. Fusion is like, let's mingle together. Okay. So once fusion takes place, there's an enzyme called reverse transcriptase inhibitor. Yeah, this reverse transcriptase is the one that convert this HIV virus to a DNA form. Because HIV virus itself is a RNA form, ribonucleic acid form. So for it to be multiplied, it has to be transformed to be DNA strand. So this is a function of these enzymes that is in our body, that is in the CD4.
Okay.
So it converts them into DNA helix. Once it is converted, it is taken to the nucleus of the cell.
Okay.
So once there, it is integrated. Integrated is like, let's assemble here for us to be taken for another copies. So once integration has taken place, now replication happen. So another copies is produced of the same, many millions of copies being produced. So after that replication, now they are being assembled together. So that assembly is now they mature. Once they mature, they bud off the cell. They leave the cell to go and attack another cells. So when they bud off, they leave this cell whole, empty. So once this cell has been ruptured because this HIV bud off, it is hollow. Anything can go in. The cell can get flaccid and burst. Okay. That's how the cell die, and that's how you'll now HIVs multiply and go and attack cells after cells after cells after cells. Yes.
Okay. So once you've tested positive, there is no way you can know how the virus got into the body. Like it might be, or how you transmitted, or you got the virus. It's either, because you've said it's either through sexual transmission, through maybe blood or something. So you cannot know how it got there.
Okay.
Not unless you have history from maybe parents or something.
Maybe history, maybe you have been pricked. At least there's an history behind that, how you got it.
Yeah.
Maybe you were pricked by something. Maybe you were involved in an accident. Maybe you have a lot of people. There's cut wound, bleeding. That can happen. Maybe you never used protection. It can happen many ways.
Okay.
I think if someone can trace what happened, because if something pricked you, definitely I'll know something pricked me.
Yeah.
And then you can come. If maybe you never took post-exposure prophylaxis, definitely there's a high chance of transmission.
Okay.
Yes.
I hope the person who asked the question, who is our videographer today,
okay,
has understood exactly what what they wanted to know.
Sure.
But talking of protection, I've I saw a video where this guy was saying he engaged himself into sexual activities, and then the protection, the CD, actually got into the vagina of the lady, and it never came out. So someone in the comment section was saying, next time buy your own size. Are there sizes?
Okay, all condoms are designed to fit on the genitals. It is the mode of or how you put on, because there's a way how you put on. You make sure there's no hair.
Okay.
You hold it the tip to release the air, and then you just put there and roll it.
Okay.
It is very difficult for it to come out unless it has a lot of air. Definitely it will burst, or it will go and attach there to the vaginal of the other gender. Yes, or obviously it will come out. Okay. The poor technique. We normally teach people when they normally visit our CCC center. We demonstrate how the condom should be put. And then also we have condom for ladies.
Oh, yeah.
Yeah. So if you feel that this partner maybe doesn't want to wear, we also have for the ladies, which it is very difficult for it maybe to tear or to come out. Yeah.
Sure. So if you find yourself in that situation,
yes,
for example, the condom has stuck inside, what can you advise someone to do in that situation? What can you advise someone to do?
Okay, people also need to understand that for you to contract HIV/AIDS, there must be a microscopic tear. That's why we normally advise people that you should prepare your partner before you engage.
Okay.
Because when you go there and maybe it's very hard, no wetness, definitely there will be bleeding and microscopic tear. If there's no microscopic tear and no bleeding, definitely to transmit HIV sometimes it's very difficult. So we normally advise them not to panic, but if you feel that maybe it happened for long without you are conscious, we can put you on post-exposure prophylaxis for 28 days, and you are there too.
Okay.
Yes, including the other partner also. Yes.
Okay. Before we go on the prep side, we've talked about protection.
Okay,
How can I prevent myself from getting HIV and AIDS?
The best way to prevent yourself from getting HIV/AIDS, number one is abstinence, which is difficult nowadays. Number two, we advise on using protection. Number three, also we avoid the sharing of the capillaries, sharp objects. Also, on blood transfusion, it should be thoroughly screened before someone receive. And then also for those mothers that are coming for antenatal clinic, we normally test them on the first visit and then also on the third visit, third trimester, to make sure that they don't have. And if they have, we initiate them, those mothers immediately on antiretrovirals.
Okay.
And then also those men-to-men sexual partner. By the way, anal sex is the most, we can say, the mode of transmission that you can easily get the HIV, because we can say the anal region, is very tight, it is very vascularized, and it can easily tear. So those men-to-men, we normally advise them to use protection condom and lubricants. You can give them lubricants so for easy penetration.
Okay.
And then also for those commercial sex workers, we advise them at least every 3 months to check their status, so that those who have, they should be initiated immediately on treatment. And for those partners that are doubting, we encourage the use of PrEP and PEP.
And PEP.
Yes.
Okay. Can someone engage in a sexual activity with someone who is positive and not get the virus?
Unless this other person, he or she is on PrEP, or after the engagement, we put you on PEP.
Okay.
Or you use protection like condom.
Okay.
Yes.
So let's talk about the PrEP and the PEP.
Yes.
What are these PrEP and PEP?
Okay, maybe to start with the PrEP, these are just ARVs drugs that have been combined. And how they work, maybe they work to prevent replication, as I was explaining earlier. They have been designed that it can prevent replication, it can prevent assembly, or that conversion to a DNA form.
Okay.
Once one stage of the HIV has been interfered, there's no maturity will take place. So what it does, this PrEP, you take it, we normally advise people, take it at least 7 days before engaging on sexual intercourse. Why? Because the drug will be in the body, waiting to take care of the virus that will come in.
Okay.
But if you take it today and you engage in the evening, maybe the synergy of the drug will not be achieved. So encourage at least use 7 days earlier. Prepare your partner early that let me use PrEP. And then when you come after the act, also continue with it at least for 20 days, or even others will encourage for 28 days.
Okay.
Yeah, that's how PEP work. It interferes with the formation of the virus, maybe replication, transcriptation, integration, and then once it is interfered, the viral load will not achieve there, and the other one will just die.
Okay.
And then for PEP now, it happened after you have been exposed. Maybe as a doctor, maybe I was teaching patient, and by bad luck, maybe the needle pricked me also. Yeah. That one I'm supposed to be subscribed. Maybe I engage to the partner who refused to be tested. I suspect, although we normally test you first to make sure that you don't have. And then we put you on a PEP so that you continue for 28 days. Okay. It's a combination of 2 or 3 drugs. And these drugs has been designed. We have nucleoside reverse transcript inhibitors, non-nucleoside protease inhibitors. All those, they perform specific function majorly to interfere with the viral multiplication or the assembly. So you make sure you continue and you are there too. If you are taking at 8, make sure you take at 8. Okay. So that you are there, so that the drug should know that I'm supposed to work at this time to make sure that I disintegrate anything that happened. Okay. If you miss today, tomorrow, there's high chance that you'll not be the virus. Yes.
So what happened? Okay. Now this is becoming interesting because sometimes we forget to take medication.
For sure.
And now, maybe for example, I've been taking them at 8, as you've said, and then I forget.
Yeah.
So does that mean I have to start again, or is that is done with?
Definitely, you don't have to start again. The reason of compliance adherence is to make sure that whatever process was taking place should continue without interference. Although there's no study much that will say if I miss at 8 that I'm going to get it. There's no that study that can support it. But we do encourage adherence, because it is adherence that we have achieved that at least 99%. Yes.
Okay. And are they 100% effective?
Yeah, if you are there too, they about 98 to 99% effective.
Okay.
Yeah, sure.
And what are some of the side effects?
Initially, we used to have some lots of those drugs. It was actually tedious, but with recent advancement of technology, they have been synergized and combined is just one tablet. We had those with a much side effect, like effervescence. People used to have nightmares. People are chasing you, yellowness of the eyes, dizziness. And you can easily tell that this someone is either taking drugs or this person is having problem with the liver. But new study has taken place, and new combination now is very tolerant to the liver, and much side effect has been reduced totally. Yes.
Okay. And I've realized you've talked about prepare your partner first. That is a statement that has stood out in the entire interview. Yeah. So is there a policy that or a law in Kenya or in the constitution? What does it say when I give the virus to someone without them knowing, or I engage in sexual activities knowing very well I'm positive without telling my partner that I'm positive?
That's a good question. Although that one we could have talked later. It is on disclosure.
Okay.
Once we have tested you and we find you are positive, you are confirmed that you are positive, there's that stage of mourning. This stage of mourning include denial. This person will always deny that I don't have the virus. Your kit are faulty. One can walk from facility to facility, really to confirm. Once they confirm, they now go to a stage of anger. These people are angry because they think everyone infected them. So they'll throw jabs in anyone. And then they go to another stage. It's called bargaining.
Okay.
Now you're bargaining that, let me try to God. So you'll go to church, sing and praise, knowing that a miracle will happen. After a long period, maybe 3 months, you feel that it is still there. Now you go into depression. So you are depressed. What am I going to do? And then you ask yourself, what if I could have not done this? Am I going to die? So if now you come into terms, now you accept the reality that for sure I am sick and I need medication. So at that point, it can take a long period of time. For others, it can take a week. We normally counsel you on disclosure. Disclose to your partner, disclose to your family, disclose to your closest relative. But I, as a doctor, I am not supposed to disclose even to your partner because we have stages of testing. That number one thing is counseling. Number two, confidentiality. That if today you come with your partner, I test you and you tell me that do not disclose to my partner, I will not.
Even though it affects my partner?
Yes, I will not.
Okay.
Yes, I will not. Unless we now teach you on disclosure. We counsel you that it's good to disclose to your partner so that for support care, for love and everything. So it is you now to choose how to disclose. Should it be disclosed by me while you are there? Will you disclose it at home? It is now upon you. So this disclosure, it prevents also. Why are we encouraging you to disclose? So that you should not go and infect another person knowingly that I'm infected, this person that don't have. You'll be prosecuted. Why? Because you infected this person knowing that already you have HIV. This person can sue you. And I think there's a law in our constitution that you'll be jailed even. Okay. Yes.
Let's talk about acceptance.
Yes.
You've gone to the facility, you've tested, it's positive. You've gone through the stages of denial, accepting and everything. Now you're comfortable, like, this is the reality. Now I have to take care of myself and everything. And we've seen so many people who are advocating and teaching people about HIV and AIDS. It's normal to have it. You just have to take your ARVs and everything. Do we have a line? Are they crossing a line? Because I feel like people are normalizing HIV. Should we normalize HIV and AIDS?
It's not normalizing. What people are doing is to create awareness, so that to break that bond of stigma and all stereotype and all the, we call it misconception about HIV. People should know that HIV do not kill. It is the AIDS that kill.
Oh, wow, okay.
Yes. If today we find you or we find me that I have AIDS, HIV, the number one thing that you should do is to put me on medication immediately. Why? Because once you subscribe me to medication, I'll suppress my viral load. Because I'm targeting at least 20 to 50 copies.
Yeah.
That one will not be detected. And they will go, by the way, HIV are very funny. If you take medication, you are there to eat, they are very bright virus. They will retreat and go and hide in a latent reservoirs of the body. These latent reservoirs are just CD4 cells, like dendrite cells, ganglion cells. We have central sensory cells, resting cells. It will hide there for eternity, waiting for you to stop medication. Yes, it will wait for you to stop medication. Once you stop medication, they will come full blown and take away you. Completely.
That's actually scary. Because is there anybody who has ever healed from HIV?
HIV doesn't have a cure.
Yeah.
The only thing that ARVs are doing is to suppress the virus. Once the virus is suppressed, our body defense, we call it CD4, it will now go high, because we are targeting at least above 200, because normal CD4 should be 500 to 1600 cells per millimeter cubic. But you find out that when viral load is high, it will suppress everything. You'll find even your CD4 is 10. Surely you'll expect AIDS to kill you. Those gonorrhea, syphilis, everything will come and take away your life completely. But when you take medication, you are there too. You will beat the viral load. They'll realize that we are dying off. We have remained just a few numbers. Let us hide. Now they'll run and hide in the latent reservoir and wait for you to avoid medication. That's why there's no cure. Because why? There's in the latent stage. But once in the latent stage, doesn't mean that you cannot transmit. You can transmit because the viral load, it's very low. It's undetectable, but you can still transmit. So maybe, I don't know if there could be a question on technology, but there's a recent technology that research is ongoing, maybe to see if you can get the cure of HIV. If you achieve 90% of adherence and all, we suppress the virus and they go to the latent reservoir. There's a technology that is coming to reactivate them. Once they are reactivated, those cells that are infected will now try to come and attack. And then maybe there will be a therapy to kill them. Number two, they are figuring out once in the latent stage, something to go and block them and kill them completely there. Maybe something like a vaccine. And then maybe to re-edit the DNA. See, I told you these things, they come and edit our DNA and take us from our DNA and make their own copies. So we re-edit and then maybe disorganize them and kill them. So I think the research is ongoing. And that's why we had the Vision 2030. This Vision 2030, number one, is to eradicate HIV completely. Once we have put them on latent reservoir. But to achieve this, there's a new injection, cabotegravir and rilpivirine, that is designed so that, a lot of people fear taking drugs daily. This injection, once you have given maybe once per month. So it's still on trial, but some advanced countries, I think USA, Russia, China, they're having them. And people are getting a HIV injection at least monthly or 2 months. That one, at least everyone will adhere. Yes. So that's a recent technology that I think is in place. And
since HIV, before, like in the 1990s, HIV was something that, if I hear someone has HIV, I was like, no, I don't want to be associated with you. Like, maybe I can get the virus by even just talking to you. I know the misconceptions were crazy back in the day. But I can see we've really tried. Like right now, people are living with HIV. They are continuing with their day-to-day lives, their activities, their jobs, and everything. What can you say as far as HIV and AIDS is concerned? How far have we come from back in the day?
To me, I can say we have come from far, and where we have reached, for real, we have tried, and we are heading there. We are heading there. Compared to, in fact, some even 10 years back, there was a lot of misconception, stigma, because there were not the much awareness was not created because NGOs were not in places, those government support were not in place, then strategies and global initiative were not in place. But right now you can see we have a global initiative, we have NGOs like USAID, they're in place to create awareness. So at least even that someone that never went to school can understand that HIV is not transmitted through sharing of toilet plate, is not transmitted through sharing of utensils. It is transmitted through sharing of sharp object, injecting drugs, and maybe using unprotected, doing unprotected sex. So at least there's awareness. And also there's introduction of topics in school, colleges. So at least everyone now is aware of HIV. And I think stigma now and the stereotype is going down compared to last those years. And then also advancement in technology. You know, last people used to go to get medication, you're given lots of stuff, a lot of tablet. So people used to fear. And then a lot of people used to avoid medication. Why? It is tiresome. And then you could see how people, they are growing thin. Any person that was thin, you'll know that, this
HIV.
one is HIV positive. This one is HIV positive. But nowadays, you cannot tell that this one is HIV. In fact, the fat one is the one that maybe he or she has. So I can say the technology is okay. And then also, this medication, I can thank the technology. Initially, it used to cause a lot of problem. You can easily know that this person is taking medication. Why? It was causing what is called lipid dystrophic. Like you find out that you had a big butt, but today buttocks has gone, you're just flat. Maybe you have just grown the big breast, you are shapeless. So it used to cause those problems. But that one was resolved. Now medication doesn't have much side effect.
Okay. So that's so much. That is so awesome at the moment. But then is there policies that have been put in place to support people living with HIV and AIDS?
Yeah, there's a lot of policies that are in place already. We have those Alma Ata conference that happened, Bamako, whatever. We have this STG, DTGs. This all mostly is to attain at least that 90% of population, at least to know their status, 90% to know to subscribe to medication. So there are a lot of policies, but the problem is these policies mostly have not been implemented. You know, maybe you have a bit of corruption. If today, Roxana, I give you 1 million to go in community to at least sensitize, to tell people that we should do this and this, definitely 800 will go to your pocket. Definitely. 200 will go to your cousin. 50 will go to your grandmother. And then maybe 30, you will call border and put them on, we call it reflectors, just to hoot around and say HIV. So policies are there, but maybe goodwill from people, from the government, they are not in place. But we thank this non-governmental organization. They are really doing much. They are really doing much.
Okay, let's talk about ART. How effective is it?
To me, they're effective. Why? It has achieved viral suppression once you are there to it, because I've explained earlier how it works, the way it is disorganized the virus. So it is very effective. You can compare even nowadays, we don't bury people with HIV, AIDS. We bury now cancer. Why? True. Because ARV has achieved a lot. It has taken the virus to suppression. So I agree, it is very effective. It is only that we have not achieved the cure, but prevention and everything we have achieved.
You are trying.
Yeah, you are trying.
Okay. So there is, I don't know which year was that, but there is a time we had the government saying that, not even the government, the hospitals were saying that we have a shortage of ARVs. How did it how did we get there to shortages of ARVs? Is it that most people are getting HIV and AIDS, or is it that the government is not doing enough in providing the ARVs?
Okay, we have World Health Organization policies that it is insisting, we say in 1990, 1990, that people that we have tested them and they are positive should be initiated and subscribe immediately to medication. But I am very sure it was not all the government, maybe of Uganda, of Tanzania, it was only Kenya. But it was recent, it was associated with maybe a bit of corruption because, we are funded, these ARV were funded by United Nations, maybe USA also involved. So we are not, I cannot talk much about it, but in the hospitals, we say we receive them. They are there. People are subscribed to it, but there was some itch there. We suspect issue with the corruption, but I'll not talk about it. Yes, I'll not talk about it.
Okay. Yeah. So where do you want us to be, Kenya-wise, in terms of HIV and AIDS? When 5 years down the line, someone mentions HIV and AIDS, where do you want Kenya to be? Okay.
I, as Regan, maybe I want our Kenyans to, in the next, maybe our vision 2030, number one, if we will not eradicate, maybe at least we achieve that global target that they want at least every person to know their status. Just go and test. And if you are positive, go for counseling, accept, and start on medication. Maybe this technology and the research that is ongoing, maybe it will pave the way for cure. Who doesn't know? So my plea, we follow the government strategy that they are saying, at least 75% we beat the stigma, and we reduce the stigma at least to 25%. We achieve 75%. At least the population that are not taking medication, we push it also at least to 75%. And then also opportunistic infection, also we beat them completely. That is our Kenyan strategy on combating the HIV. So my play and let's say my vision is to see those all are achieved so that we'll be there by the year 2030.
Yes. So maybe someone is watching you at the moment and they are wondering, where can I get the PrEP and the PEP, and how much does it cost?
PrEP and PEP, they are all free.
Oh wow.
They are all free. They're all funded by the government, United Nations, and we have hospitals that they have them, but most government hospitals have them. In private hospitals, we have also that have a comprehensive care clinic because we normally say that we should have youth-friendly, that it should be counseled, it should be tested before you are initiated on any ARVs. So we have selected the private facility that have stocked them. It is free. Maybe for ARVs itself, maybe they can charge you service fee, but it cannot go beyond 300 shillings because also they want those files, so it happened, but it is free. So once you suspect that I am having or I was exposed, you just come. Will not be on your neck, maybe how reckless you are, we'll start you immediately because we want to achieve the global target. Yes, maybe we'll start on you and then maybe tell you if you see this reaction, maybe sometimes you can react to the drug. Maybe come after 3 days, we see how we can do it. And for PrEP also, maybe your partner is having HIV positive and maybe you want to have babies. You come, we counsel you what you can do and you can get your babies clean without infecting each other. Yes. So that means I can breastfeed my baby even though I'm positive and my baby to be negative. Sure. That's why on ANC visit, antenatal clinic, once we test you and you are HIV positive, we subscribe or we initiate you immediately to ARVs. Why? So that you suppress the virus, so that you should not transmit during breastfeeding. And remember, this baby that you will get will also put the baby on prophylaxis. She will continue the prophylaxis to the entire period that you are breastfeeding. Yes. So that at least we prevent complete transmission from mother to child. Yes. That has been a very interesting conversation. So where can people find you? I am based in Valley Hospital, Nakuru. it is opposite Oleken Hotel, West Road, or near the, we normally call Waterbucks Hotel. That's where we're located. I'm the current in charge of the comprehensive care clinic and STDs.
Yeah.
Yes, so you come there, you'll find Regan. Yes.
Yeah. Thank you so much for coming, Regan.
Yes.
This was very insightful and educative. Like, I've really, really learned a lot.
Yeah,
I
sure.
thought I knew it all. Kumbe I don't.
Sure. Yeah.
Yeah, but thank you so much for everybody who is watching today. And if you've stumbled upon this video, that's a sign for you to go and get tested, because knowing your status is very important for you to protect yourself and to protect everyone around you. Anyway, guys, thank you so much for tuning in. It has been Health Check with me, Roxana Gishia. See you next week.